Hello, this is Alex. Welcome to my channel where I discuss health conditions and their treatments, both conventional and complementary. I also discuss natural remedies and nutrition. This video is part 3 of my series on alcoholism. Feel free to watch parts 1 and 2 where I discuss what alcoholism is, the symptoms, withdrawal symptoms, health effects, complications, causes, and conventional treatments. I have linked these videos in the description below. In this video, I will discuss some of the complementary treatments for alcoholism. Lots of valuable information, so stay tuned till the end. Also, if you enjoy this content, please hit the like button, subscribe to my channel, and hit the notification bell and click all so you won't miss a video. Now let's get into this video. The main treatment goal from a complementary perspective involves supporting the alcoholic with better nutrition, counselling and psychological support, and herbal medicines to deal with alcohol-related problems such as liver damage. Many nutritional problems of alcoholics relate to the effects of alcohol. However, a major contributing factor is that alcoholics tend not to eat and substitute food for alcohol. Therefore, the alcoholic has to deal with secondary nutritional deficiencies caused by excess alcohol consumption, but also primary nutritional deficiencies due to inadequate intake. Social support is critical for both the patient and their family. It is important for the alcoholic to recognize their problem and that both the alcoholic and their family learn about the physical and psychosocial effects of alcoholism and that the patient become involved in a treatment program. Alcoholics Anonymous and counselling often plays a big role in success. Strict abstinence from alcohol is the safest and most effective choice. In relation to diet, initially it is best to stabilise the person on a typical hypoglycaemic diet to provide a stable blood sugar level. If possible, a diet consisting of 50% whole grains with no refined cooked vegetables. Regular protein snacks every 2 hours helps to stabilise the blood sugar levels. Vegetables that increase blood sugar levels, such as carrots, should be avoided. This normalises the blood sugar and stops a physiological alcoholic addiction. There are many supplements which help with alcoholism, for example, zinc, because alcoholism results in zinc deficiency. Low zinc levels in alcoholics is due to a reduced dietary intake and absorption and increased excretion of zinc in the urine. Low zinc is also associated with impaired alcohol metabolism. Zinc taken with vitamin C increases alcohol detoxification and survival in rats and may have a similar effect in humans. Vitamin A deficiency is also common in alcoholics. In alcoholics, there is reduced intestinal absorption of vitamin A and zinc, as well as impaired liver function, resulting in lower blood levels of vitamin A, zinc, and their transport proteins. In body tissues, these reduced levels of zinc and vitamin A cause abnormal enzyme activities, abnormal protein synthesis, and impaired cellular function. In the kidney, they increase the loss of zinc. These metabolic abnormalities then lead to the common disorders of alcoholism, which include night blindness, skin disorders, hormonal disturbance, cirrhosis, reduced skin healing, decreased testicular function, and impaired immune function. Research on rats highlights the impact of the endocrine system on alcoholic preference. The removal of ovaries and adrenal glands in female rats decreased their preference for alcohol, while cortisone injections increased their alcohol preference. Vitamin A supplementation in the alcoholic has been known to correct vitamin A deficiency, as noted by improvements in night blindness and sexual function. A liver that has been damaged by excessive alcohol consumption loses its ability to store vitamin A. As a result, an alcoholic who continues to drink or shows evidence of impaired liver function is at great risk for developing vitamin A toxicity when the vitamin is given at doses above the recommended dietary allowance of 5,000 international units. Alcohol causes an increase in free radical or reactive toxin levels and damage. This is made worse by the fact that alcoholics are usually deficient in nutrients such as vitamin E, selenium, and vitamin C. Antioxidants taken before or with alcohol inhibits the free radical damage and development of a fatty liver. Effective antioxidants include vitamin C and cysteine. The use of lipotropic agents, which promotes the flow of fat to and from the liver, appears to treat alcoholic fatty liver disease. Many commonly used lipotropic agents include choline, niacin, and cysteine. However, they have little value. Carnitine, which usually aids in fatty acid transport and breakdown, is one lipotropic agent which does inhibit alcohol-induced fatty liver disease. It is believed that chronic alcohol consumption results in a functional deficiency of carnitine. Normally, the body is able to make sufficient levels of carnitine. However, to make carnitine, the body must have adequate levels of vitamin B6, vitamin C, and other nutrients. Since the alcoholic is often deficient in these nutrients, they are also deficient in carnitine. When carnitine is low, fat tends to accumulate in the liver. This is evident in alcohol-induced fatty liver. An increased level of carnitine may be required to handle the increased fatty acid load produced by alcohol consumption. Carnitine breaks down fat, which in turn lowers triglyceride levels and improves liver function. Blood levels of amino acids are compromised in alcoholics. Since the liver is the main site for amino acid metabolism, it is not surprising that alcoholics develop abnormal amino acid patterns. Patients with hepatic cirrhosis, severe fluid retention in abdomen, weakness and fatigue, and weight loss must normalise their plasma amino acids. Supplementing with Valine, isoleucine and leucine greatly aids the alcoholic with cirrhosis. The amino acid glutamine reduces voluntary alcohol consumption in uncontrolled human studies and experimental animal studies. The non-essential amino acid L-glutamine provides brain cells with an energy source. It reduces alcoholic cravings and decreases the harmful poisoning effects of alcohol. Glutathione protects the liver from damage and reduces alcohol craving. L-methionine works with glutathione to protect the liver from damage. L-cysteine aids in liver regeneration. Tyrosine, taken with vitamin B3, helps reduce withdrawal symptoms of alcohol. D-L-phenylalanine also reduces withdrawal symptoms. Low tryptophan is common in alcoholics. Tryptophan is the amino acid that is converted to serotonin. Low serotonin is common in people with depression. Therefore, supplementing with 5-hydroxytryptophan helps the recovering alcoholic with increasing serotonin in the brain. Vitamin C deficiency is found in approximately 91% of patients with alcohol-related diseases. Vitamin C supplements help to reduce the effects of acute and chronic alcohol toxicity in experimental studies involving humans and guinea pigs, which are two species unable to synthesize their own vitamin C. There is a direct link between vitamin C levels in white blood cells and the rate of clearance of alcohol from the blood. Higher vitamin C levels are associated with a faster rate of detoxification of alcohol from the blood. In alcoholics, low vitamin B levels are usually the result of low dietary intake, impaired absorption, decreased storage capacity, and impaired conversion or increased deactivation of the active form of the B vitamin. A deficiency in thiamine or vitamin B1 is most common and the most serious out of the vitamin B deficiencies in the alcoholic. Thiamine deficiency results in greater intake of alcohol, which suggests that low thiamine is a predisposing factor for alcoholism. Vitamin B1 deficiency is known as beriberi. Late stages of beriberi are similar to late stages of alcoholism. A functional vitamin B6 deficiency is also common. It is more due to an impaired conversion to its active form, pyridoxal 5-phosphate, than it is to inadequate intake. As well as inhibiting conversion to more active forms, alcohol also decreases the absorption and utilization of many B vitamins by the liver, especially folic acid, and increases their urinary excretion. Vitamin B3 helps reduce alcohol cravings. Vitamin B5 helps reduce the effects of stress and helps with alcohol detoxification. Chromium helps reduce hypoglycemia or normalise blood sugar levels. Vitamin D or plenty of sunshine also helps a recovering alcoholic. Calcium has an antispasmodic and sedative effect which supports the nervous system of recovering alcoholics. Raw adrenal tablets help to support the adrenals and reduce stress. Digestive enzymes stabilise the blood glucose levels and oxidise the alcohol, breaking it for extra energy and eliminating unwanted components from the body. Herbs which help with alcoholism include St. Mary's thistle, which protects and restores the liver structure and function. It helps especially with liver involvement or cirrhosis and has been helpful in treating mild to serious cirrhosis. The best benefit is prolonging the lifespan of these patients. In one study, 87 cirrhotics, including 46 with alcoholic cirrhosis, received St. Mary's thistle, while 83 cirrhotics, including 45 with alcoholic cirrhosis, received a placebo. The average observation period was 41 months. In the treatment group, there were 24 deaths, with 18 related to liver disease. In the control group, there were 37, with 31 related to liver disease. The 4-year survival rate was 58% in the treatment group and 39% in the control group. St. Mary's thistle can improve immune function in cirrhosis patients. Whether this effect is responsible for any direct benefit to the cirrhosis has yet to be determined. St. John's wort is a central nervous system relaxant which helps with reducing alcohol intake. It regulates brain chemistry to reduce dependence on alcohol and can help reduce alcohol withdrawal symptoms. It is a potential additional therapy for alcohol addiction. However, this is yet to be confirmed by human studies. Many studies have noted drug interactions with St. John's wort, so it is essential to consult with a health practitioner before using it. Siberian ginseng has an adaptogenic effect, which means it works to counteract the effects of stress in the body. Siberian ginseng also supports the adrenal glands, which can become fatigued from alcoholism. The adrenal glands produce hormones that regulate metabolism, immune system, blood pressure, response to stress, and other essential functions. Valerian has a calming and sedative effect which can help to reduce withdrawal symptoms. It can also help control alcoholic shakes, reduce anxiety, which may have been a trigger for alcoholics, and improve sleep. Dandelion is commonly used for liver problems, although there is evidence that it helps reduce the symptoms of alcoholic withdrawal. It is often used together with milk thistle. However, dandelion can interact with many medicines, so it is important to consult with a doctor. Magnesium deficiency is common in alcoholics, and this deficiency is thought to be the reason for the increase of heart disease noted in alcoholics. Magnesium deficiency is due mainly to a reduced magnesium intake plus increased loss of magnesium in the urine due to heavy alcohol consumption. Alcohol interferes with essential fatty acid or EFA metabolism, and for EFA metabolism to improve, it is better to stop drinking rather than take EFA supplements. Other therapies include exercise, which improves the chances of staying abstinent from alcohol. Research has shown that regular exercise is helpful in reducing anxiety and depression and helps respond better to stress. Improved fitness may promote a better response to emotional upset, therefore reducing the likelihood of drinking alcohol when upset. Thank you so much for watching this video. If you would like more information on this topic of alcoholism, please check out parts 1 and 2. I have linked them in the description below. If you enjoy this type of content, don't forget to hit the like button and subscribe to my channel for more informative videos on health conditions and their treatments, natural remedies and nutrition. Also, feel free to leave a comment. Do you know someone who has suffered with alcoholism? If so, have they used any of the above-mentioned treatments? If so, have they had any success with them? I would love to know what has worked. I look forward to sharing another video with you soon. Bye for now.